Frances Riggs works for the Latrobe Community Health Service, an NDIS partner in the community in Sydney, Melbourne and regional Victoria. Certainly been on the grow that organisation since the start of the NDIS. As a senior community development and capacity building coordinator, Frances leads a team of people across 10 service areas who are working towards an inclusive and accessible Australia. Frances's team works alongside community organisations, mainstream service providers and businesses with the aim to create more opportunities for people with disability to participate in all aspects of community life. Frances has worked in a range of areas, including disability, health, aged care, community development, alcohol and other drugs and family violence, both overseas and here. And she joined LCHS 4.5 years ago and has worked in a range of roles, including community capacity building and local area coordination. She previously worked for the NDIA at the Barwon trial site. That's going back a few years, and I'm sure there's some interesting stories came out of that time. I know I was at Melbourne City Mission during the trial site stage, and we put a space, an office in Barwon to test it out, and that was an exciting time for us all. Frances is excited to be part of delivering the social reform that is the NDIS. She's passionate about undertaking and supporting activities that build the capacity of the community to be more accessible to and inclusive of people with disabilities. Frances would love to see increased opportunity for people with disabilities to build their capabilities and meaningfully participate in and contribute in the community as valuable citizens. And I believe, Frances, you're going to tell us about one of those programs now. So I'll hand over to you. Thank you, Frances.
Thanks, Dave. Hi everyone, lovely to join you all today to celebrate International Day of People with Disability. Before I begin, I'd like to acknowledge people with a disability with lived experience, their family, friends and carers for the contributions they make to our society. Our world benefits hugely from the contributions and the innovations people with a disability make every day. Now I'm going to share my screen with you, and it looks like the host has disabled participant screen sharing because I've got a few slides. Can you help me out, Laura?
Yeah, I'm just screen sharing. Oh, where? Okay, you should be right now.
Thank you. Good. Is that slide coming through okay? Great, thank you. So essentially on the screen, there's a picture of the area across Victoria that Latrobe Community Health Services covers. As Dave said, we have grown exponentially. Latrobe Community Health Service has merged with LINC, and LINC historically has early childhood, early intervention contracts. So Latrobe Community Health Services is combined between local area coordination services and early childhood, early intervention services. So you can see we do cover, it's all of those green and light green, all different shades, quite a bulk of Victoria. So it's the dark blue that we don't cover. So I won't bore you and read out all of those. You can see all of those names. Essentially, Latrobe Community Health Services merged with LINC, who were delivering early childhood, early intervention in 5 service areas. You may be aware that Latrobe Community Health Services is a partner in the community, delivering the National Disability Insurance Scheme both for 0 to 6-year-olds, so that's what we call ECI, I'll just shorten it now, and 7 to 64-year-olds, so that's LAC, or Local Area Coordination Service. So quote, most prominently, we're known for providing that early intervention and assistance to people with a disability, carers and families, whether eligible for the NDIS or not. To be clear from the outset, I don't work in the ECI space at all. So if anyone's got any questions around that area, I'm happy to pass those on to my manager who is involved in that aspect of our work. As part of our contract, so other than the delivery of the NDIS and that direct assistance around exploring eligibility for the scheme and developing plans and implementing plans. We're also contracted to work to build a more inclusive community across our service areas that's more inclusive and accessible for people with a disability and children with developmental delay. So you can see on that slide, there's a hyperlink there, and essentially that's a section of our website that does talk a little bit more about specifically what we are doing, and I encourage you to have a look on that to learn a bit more. So essentially, the aspect of the work that I'm going to talk about today that I was involved in was a collaboration that we undertook at the Ballarat Aquatic and Leisure Centre in collaboration with a range of stakeholders. So Ballarat Aquatic and Leisure Centre, and I'll just call it BALC now because that's a bit long-winded too, is a City of Ballarat facility. As we all know, collaboration work and community development takes time. It's certainly, we took the time to build the relationship over a year and had conversations and worked with BALC around access and inclusion in general, seeking to build engagement and trust with the centre first. And the City of Ballarat before we involved any other stakeholders to pursue this targeted initiative of the quiet sensory time for children and adults with autism. So essentially what we undertook first was we undertook some initial work with the City of Ballarat around those conversations around access and inclusion, where we wanted to know what sort of work have you already undertaken around access and inclusion, which was quite extensive. So it wasn't as if they weren't already across access and inclusion. We just wanted to extend and resource and support that further. So we worked with them and sought to identify some areas for improvement, and we invited their completion of what we called a provider self-assessment, where we can identify some barriers and seek to resource and support some improvements in around that. So essentially the areas of outcomes initially in this work where we were just working directly with BALC was that as a result, BALC registered and became an accredited autism swim centre, and 13 instructors have completed the highest level of online training, and Sport and Recreation Victoria have offered to provide them face-to-face training to follow on from that online training as well. At the time, the Grampians Regional Communication Service was still funded, and we engaged that service, and they provided directly inclusive communication and easy English training, and they developed communication boards for BALC. That was across both the aquatics and the gymnasium program. Then BALC itself spent some money through the City of Ballarat and engaged a disability accessibility consultant to undertake an audit of the facility itself. So there was deep commitment from the City of Ballarat and BALC itself. There was a few things that were identified that could be improved. So for instance, a drag mat was purchased to get people out of the pool quickly in case of an emergency, because that mechanism didn't exist before. Also, it was agreed that the centre is located quite closely to the Ballarat Specialist School. So it was set up that some volunteer gym coaching opportunities could be offered to senior school students at the Ballarat Specialist School as an extension of their options for post-school. As we were working directly with them, we wanted to convey that needs of people in the community. So what we did at Latrobe was a survey. We wanted to build an understanding of what's required to improve access and inclusion for children and adults on the autism spectrum, their carers and families. So we were aware of the numbers of people with autism in the City of Ballarat. So we were bringing a need to the centre and seeking to identify what was possible to meet that need. So the sort of questions that we asked in that survey, what was their experience of accessing bulk already, and what sort of areas of improvement would they be able to identify? What sort of issues did they identify that needed improvement? So straight up things like the change rooms, it was too loud, there were too many people, they thought staff could benefit from training around autism. We asked them whether they were interested in sensory sessions for people with autism, which would restrict peripheral sensory inputs such as lighting, sound and noise in the swimming and other recreational areas at bulk. And they thought that smaller group numbers of swimming groups lessons and a consistency of teacher would be an improvement. They also suggested pictorials of how to do the exercises, whether that was in aquatics or whether that was in gymnasiums, could be developed. We also surveyed service providers, because service providers bring their clients to the centre. It's a highly used, busy public centre. So we wanted to hear their views of the same sort of questions. They too were very interested in the possibility of a sensory quiet session being developed. So after we completed the survey, Ballarat Autism Network, which is made up of 500 plus families, and Sports Central, our local regional sports assembly to Ballarat, joined the collaboration to resource and support the initiative after bulk and the City of Ballarat accepted the need that we had demonstrated in the survey that I just outlined. So the Ballarat Autism Network shared their lived experience in all meeting processes and consultations about the development of this initiative. The City of Ballarat once again spent more resources and engaged a consultant to hold face-to-face group interviews and phone interviews with bulk customers to find out about their experiences of accessing bulk and its programs and what the sensory quiet process could look like. And once again, the Ballarat Autism Network and Sports Central were involved in all of those consultations. The data from those consultations was combined with the data that we had developed in the initial survey to build a comprehensive picture of the need and inform an approach to meet those needs. So what did the sensory quiet time look like? So you can see the times of operation that were up here. So it was a pilot. And essentially what it did involve was lights being dimmed, music and announcements turned off only for emergency, would they be on. Signage was put up at the front desk and around the centre to alert customers of the sensory quiet time and verbal announcements. There was 2 group dedicated change rooms with signage set up. And there was a commitment made for consistent swimming teachers and gymnastic coaches and dedicated lane spaces to be made available. Lifeguards were provided with scripts to approach customers generating too much noise. There's a need for community education around what we were trying to do, and so that the general public were aware of that. Also, training was provided to frontline staff. Now, it wasn't just on the Quiet Sensory Time initiative, but it was about supporting information on what was available in terms of the aquatics and the gymnasium programs, and being able to message to the public and inquiries around a tailored approach could be delivered specific to that person's needs. Because as you would appreciate, everyone's sensory profile is unique. And so we had, for instance, in those surveys, heard from some people who were pretty clear they weren't going to return to the centre because they had very bad experiences of going, and how that played out for them quite negatively. So when we offered that feedback, we wanted then to reassure and build confidence and reassure that there was scope to be able to address those situations should that happen. It was also put in place an escalation process should communication fall down and not work very well. So another thing that was developed was a social story that was developed by the Ballarat Autism Network that was specifically mirrored what the centre looked like. So it mapped out from the moment someone enters the centre until they're engaged in the classes, what that looked like. So that offers some understanding, some predictability, some comfortability for the people who are potentially participating in the aquatics and the gymnasium programs. Also, visit passes were offered because there was an issue identified about standing in queues and the distress that can cause some people. So specifically, the sensory balance play was set up for 18-month to 5-year-olds in the gym. There was access available during this periods of time to a water play and a pool play group for 1 to 5-year-olds, and there was casual private swimming lessons. So what did people think of it? So we had some very positive feedback. People were able to lodge feedback either through the Rate-a-Let feedback iPad in the foyer of the centre or via the website at BALC, or they could lodge that feedback directly at Latrobe Community Health Services. So here's a couple of comments that were made. Thank you very much for your wonderful initiative. My son and I, along with another couple of friends, attended today. From 3 to 4. It was just wonderful, quiet, no stares, no comments, and just an all-round positive experience. My mate and I intend to bring our boys each week now, something I wouldn't have never have done before this initiative. And another comment, more relaxing for my son with so much more, less noise. Great idea. So where to from here? So clearly, because of COVID, things have been restricted around operations. The quiet sensory time is not currently operational. The centre has had a change in management, and I'm having discussions with management around the resumption in time. There is a commitment for that to happen. It's just about staging the opening of the centre at this point in time. There's been a couple of things identified through the trial that could be added as improvements. So there are quotes being undertaken for adult change tables to be installed in those specific sensory quiet time change rooms. There's going to be some chimes or soothing music at the beginning and the end of the sensory quiet time. That's being investigated because the current PA system can't accommodate that. There's budget being explored, so there's a commitment to look at that, to install external blinds that can be lowered during the periods of bright conditions, and exploring whether the sensory quiet time can be held at broader times, because currently school-age children who are seeking lessons after school wouldn't be able to enter during a sensory quiet time at this point in time. And also there's an issue being identified about trying to balance the sensory quiet time with other noisy programs that do run at the busy public centre. The Ballarat Autism Network, made up of those 500 families, are front and centre at the continuous quality improvement of this initiative. So we're looking to continually improve the experience and how it's been set up through that network. So the other element of improvement is looking to extend the sensory quiet time to cover all areas of the centre. The other thing that needs to be improved is that to really put publicly that the centre is an autism accredited, Autism Swim accredited centre, because there's no signage that indicates that. So that can build some confidence for people joining the centre. So they were the slides, so I'll stop sharing. Is it still on?
Yeah, it's still on, but thank you, Frances. That was
no worries.
A fantastic introduction to the work you're doing. It sounds like a brilliant initiative, and I really hope it gets back up and running again. I have a few questions, but I'll save them till the panel and the discussion time.